Treating caregivers well, a shared responsibility. They are social phenomena that, while still very much present, are poorly documented because they fall into a blind spot. This is the case with the mistreatment of caregivers. The first action research carried out on the subject in Quebec shed light on the sources of this mistreatment in all its forms, and led to the development of an awareness toolbox. Together we will look at the findings of this action research. If you would like more information, you can watch the capsule explaining the action research process, or the one describing the facilitation of an awareness workshop. This is what the capsule is about. Main findings of the action research, analytical framework, reasons for the silence around mistreatment of caregivers, mistreatment awareness, fostering well treatment, elements to consider when creating a tool for awareness and prevention, and finally, the toolbox. First, we will look at what the action research has helped us achieve. First, it's difficult to remain focused on the mistreatment of caregivers. In the interviews, but especially in the group discussions, the remarks from caseworkers and caregivers often veered towards mistreatment of the elderly. Moreover, several had come to believe that we were talking about elder abuse. It was only when the first questions were posed that they understood what we were actually referring to. Next, we realized that it's often difficult to separate or isolate mistreatment from caregiving, as they are often confused with one another. For example, the participants in the research spoke of exhaustion, impoverishment, and isolation as consequences of mistreatment, but these are also known as consequences of caregiving. So how can we make the difference? Is caregiving in fact a certain form of mistreatment? Is mistreatment always part of caregiving? Of course not. So we need to document the specific consequences of mistreatment that our research has not really been able to reveal. In the same vein, it is also difficult to develop a gendered analysis of mistreatment of caregivers because the participants gave us no response about the differences in caregiving between men and women, such as men ask for less help, the services are adapted to men, families support them more because there are not the natural resources for being caregivers. Perhaps this points to the differences of mistreatment of caregivers depending on whether they are men or women, but it is difficult to know whether the participants were thinking instead merely of the differences between male and female caregivers. We will now take a look at the analytical or theoretical framework that guided our action research. In our study, we used a bio-ecological approach to grasp the phenomena of the mistreatment of caregivers as a whole. The bio-ecological approach by Bronfenbrenner of 2005 is based on the ecological approach to the human development systems put forward by Bronfenbrenner in 1979. Yuri Bronfenbrenner was a Russian-born American psychologist who developed the popular ecological theory of systems that at the outset only contained a microsystem, a mesosystem, an exosystem, and a macrosystem, to look at how a child develops and conducts themselves over the course of their life. According to the classic ecological approach, the individual is considered as a system and is able to act and influence the other systems, and may also be influenced by the latter. Moreover, the central idea behind this approach is that all systems form an interdependent whole with constant interaction amongst themselves. The ecological approach was modified during the 90s and has evolved to become the bio-ecological approach presented here. When the project began, we asked ourselves why no one talks about the mistreatment of caregivers. The participants provided us with reasons for the silence around mistreatment of caregivers. We have classified them under different systems of our analytical framework. In the macro system, what we refer to here as society, there is a trivialization and a normalization of the caregiver's role, due in particular to the cultural values seen as normal for taking care of a loved one. In the exosystem, what we refer to here as policy, there is in fact an absence of specific policies for caregivers, or a lack of consideration for caregivers in other policies. In the mesosystem, what we refer to here as institution, there is a lack of access to and information about support services. There is a normalization of abusive acts and words from the people being cared for, usually due to illness, and a justification of acts and words from caseworkers, in particular due to a lack of resources. In the microsystem, what we refer to here as family and friends, sometimes there are dynamics of long-standing violence, for example, family secrets, or family and social pressures that prevent us from talking about mistreatment of caregivers. In the ontosystem, which here is the caregiver, there are many reasons for the silence around the situation of mistreatment. Caregivers do not know that mistreatment is, and trivialize their own problems with mistreatment of the caregiver. It's normal, I don't have a choice. Caregivers have personal beliefs and values associated with their role and its consequences. Caregivers are unwilling to complain to the family or break any ties, so they don't mention the mistreatment. Caregivers are fearful of placement in a care home, of prosecution if they talk about the mistreatment they experience. Caregivers have limited financial means, which hinders certain means of resources or obliges them to remain in certain situations, even unhealthy ones. Finally, in the chronosystem, we talk about time, the era. Over the last few decades, there has been little mention of caregivers, even less of any mistreatment that they may have experienced. However, it now seems time to do something about it. The social and political circumstances are propitious. The time has come. Bear in mind here, the reasons for mistreatment of caregivers not being talked about are found in all systems and at all levels. Once we understood why no one talks much about the mistreatment of caregivers, we asked participants to tell us how we could raise awareness of this phenomenon and who should be doing it. To our great surprise, the participants told us everyone. The caregivers themselves, the people who are mistreated, work, healthcare and student environments, the government, the neighborhood, students in the healthcare and social services field, who are future caseworkers. But all the participants in all the groups emphasized the youth and schools. For them, awareness should begin early. Children and teens must understand what a caregiver is, what they do, how they help, not forgetting that some of them are also caregivers. The message here is clear. If we wish to raise awareness on this phenomenon, we must talk to everyone who is involved. So we wanted to find out more about how we could foster the well treatment of caregivers. So how can each of these systems foster well treatment? In terms of the macro system or society, well treatment is fostered by taking the time to change social values, valuing the caregiver and the humanist values involved, prioritizing living with dignity, valuing the elderly and thereby reduce ageism and ableism. These value changes towards well treatment take time, and thus we must also take the chrono system into account. Next, in terms of the exosystem or social policies, well treatment is fostered by helping community organizations that support caregivers, promoting the social and political recognition of caregivers through a policy, a bill, etc., and encourage the community assistance. At the mesosystem level or institutions, while treatment is fostered by increasing recognition of the contribution made by caregivers and their expertise, introducing measures for flexibility and work caregiving personal life balance, creating tools to foster well treatment, training staff from a perspective of well treatment, improving the service offer for caregivers, providing caregivers with prevention tools right from the start, systematically assigning a social worker or a caseworker to each caregiver. This will involve reducing the workload and the number of files, and setting up family committees in care homes. In terms of the microsystem, or family and friends, well treatment is fostered by the person being cared for and by the entourage. In certain cases, when they are able to do so, the person being cared for must agree to receive the services offered and acknowledge what the caregiver does for them. The entourage, whether it consists of family members, neighbors, or friends, can offer the caregiver support. Finally, the microsystem, or the caregivers themselves, can contribute to fostering their own well treatment. They can certainly understand that well treatment is a right, it is not a privilege that they must earn. Learn to value themselves, acknowledge themselves, identify themselves as caregivers, and be proud of all that. Treat themselves well and be willing to accept help. Thus, we can see that fostering the well treatment of caregivers involves all the systems. Taking all of this into account, what should we consider in the development of an awareness and prevention tool for the phenomenon of mistreatment of caregivers? Just as fostering well treatment involves all the systems, we categorize the suggestions for participants based on the same systems. On a wider scale, in terms of society, the participants suggested a publicity campaign, TV, radio, highway billboards, public transit ads, using a well-known spokesperson who would support the cause of caregiving and would be prepared to speak about the risk of mistreatment and promoting well treatment, presenting a reality show featuring caregivers who we would follow on a daily do interviews on well-known popular TV broadcasts like Daybreak, Quebec AM, Radio Noon, CTV News, and create video clips or blogs. In terms of policies, the participants suggested putting in place a national policy. This is done. We have had a bill since 2020 and a national policy since April 21. Increasing income tax credits, offering compensations, and improving support services. In terms of institutions, the participants have several suggestions. Train local caseworkers to identify and promote the services offered to caregivers, raise awareness to other stakeholders like police officers, pharmacists, legal systems, unions, inform and educate national and regional community organizations, inform employee assistance programs, organize training seminars, set up a watchdog network to identify situations of mistreatment, open files for caregivers, and encourage collaborative work. In terms of family and close friends, the participants suggest to raise awareness to the people being cared for example, with posters or leaflets in day centers, raising awareness in the entourage with family meetings, posters, and leaflets, and creating promotional materials, special ribbons for caregivers, stickers, posters, leaflets, etc. Finally, caregivers themselves can help foster well treatment. The participants suggest developing a mindfulness tool for mistreatment, discussing the risks involved in caregiving, including mistreatment, developing individual strategies to reduce the risk of mistreatment, and creating leaflets like mindfulness scale for risk levels, testimonies, evidence, etc. Based on these findings and with the help of all those who contributed, along with the participants in the action research, we developed an awareness toolbox for the mistreatment of caregivers. The review of the literature showed that the mistreatment of caregivers essentially comes from the people being cared for. In our research, we identified four sources or origins of mistreatment. Mistreatment seems to come mainly from institutions, through caseworkers or healthcare professionals, then the entourage, close contacts, family, friends, neighbors. Next in line for those who seem to mistreat caregivers the most are the people being cared for, and then to a lesser extent the caregivers themselves. After that, we found that our research showed that no matter the sources of the mistreatment, its manifestations or its forms can be grouped into 7 categories. Thus, each of the 4 sources, institutions, the entourage, the person being cared for, and the caregiver, mistreat the caregiver in their own way at some point along the caregiver's journey using one or more of these forms. Imposing the role of caregiver and making them over-accountable, judging the way the caregiver does things, normalizing the role of the caregiver or the mistreatment experience while performing the role, denigrating the expertise of the caregiver and their familial and social contribution, denying the needs of the caregiver, using psychological, physical, or sexual violence towards the caregiver, and contributing to the impoverishment of the caregiver. Based on the findings from our research, we have proposed this definition of mistreatment of caregivers. Performing the role of caregiver carries with it the risk of mistreatment, which affects the caregiver. The mistreatment comes from institutions, the entourage, the person being cared for, or the caregivers themselves. Whether intentional or not, it manifests itself through the absence of appropriate action, an attitude or act that occurs once or repeatedly. The mistreatment of caregivers can take one or several of these forms and change over time. Imposing a role of caregiver and making them over-accountable, judgments about the way the caregiver does things, normalizing the role of the caregiver or the mistreatment experience while performing the role, denigration of the expertise of the caregiver and their familial and social contribution, denial of the needs of the caregiver, use of psychological, physical, or sexual violence towards the caregiver, and contributing to the impoverishment of the caregiver. Finally, our research has allowed us to propose a definition of well-treatment of caregivers. Well-treatment of caregivers is a comprehensive process of accompaniment. Its goal is to foster support for caregivers, listen to their needs, and value their contribution, their experiences, and their skills in a daily living in order to prevent mistreatment. Finally, based on all of these results, we created a poster, a facilitation guide, which is used with the poster, and 3 leaflets adapted to different audiences: caseworkers, the entourage, and caregivers. In addition, we developed narrated PowerPoints or capsules. The poster is titled Treating Caregivers Well, a Shared Responsibility. The idea is to think of caregiving as a journey during which mistreatment may be present. However, we have to be mindful of the fact that not all caregivers are mistreated while performing the role, and that mistreatment is perceived differently depending on the people involved and the context. The poster can be used for discussion purposes as a whole, or small sections can be dealt with one at a time. Another capsule will show you how to use these tools. You can now download the tools, the poster, the guide, and the pamphlets on the HONC website at www.honc.qc.ca. It is now up to you to contribute to the good treatment of caregivers. Thank you for listening.